The hospital is a 124-bed capacity hospital. It started in 1986, where it started as a small dispensary which used to provide the services to people who could afford. So at the time it was charging fees. But when the conflict began in 1990, the hospital was open to the public, and the hospital became probably the only functional hospital in Mogadishu. The hospital has mainly two parts. It has the pediatric section and the maternity section. The maternity section comprises of both outpatient and inpatient section. The OPD, on an average day, we hold about 100 consultations per day, and we also receive 30 other emergencies, like for example women who come with the bleeding, with the complications during pregnancy. They are admitted as a matter of emergency. Then we have labor ward. On average we deliver about 15 to 20 patients on an average day. Then the operation theatre also performs common obstetric operations such as cesarean sections. And in an average month we operate between 50 to 60 mothers. Then in late September 2013 we opened a newborn unit, and this newborn unit provides care and resuscitation to newborns who are either delivered within the hospital or who have been referred from the community and the private clinics neighboring the hospital. And here on average we handle between 50 to 60 newborn admissions per month. Then we move on to the pediatric section. The pediatric section has about 76 beds, and we have about 3 wards. The first ward is a mixed ward where we admit children with common conditions like pneumonia, bronchitis, bronchial asthma, and this kind of new convulsions and these kind of things. And then we have another ward where we admit measles cases specifically. In Somalia, measles is there throughout the year, and the wards are actually full right now as we speak with measles cases. Then we have another ward where we admit children with the severe acute malnutrition, some with the complications, and we treat them using the standard treatment guidelines. And on average here, we admit between 100 to 150 patients on an average month. So in general, those are the services that are provided in the pediatric section. Then we have the outpatient section. The outpatient pediatric section on average also sees 200 patients in a given day. Then we have another about 50 to 60 cases that are seen in the emergency section, where they are admitted directly to the wards. Then on top of that we have a laboratory section. The laboratory section it comprises of 2 sections, the laboratory section and the blood bank section. The blood bank and the laboratory are open 24 hours a day, and we provide immediate, life-saving transfusions to patients who need blood transfusion. In 2014 we did a lot of improvements to the lab. Initially we used to perform very simple serological tests and also urinalysis, stool and this kind of stuff. But now we have improved that section. We do quite a lot of biochemistry. We do hematology tests such as full hemogram. So the laboratory has also seen quite a lot of growth. And that section is manned by about 6 qualified laboratory technicians. But when you see the kind of workload which is there in the laboratory, it is very huge. So so they handle a very high caseload. Then we have the MCH section, mainly where we attend antenatal, we provide antenatal care to pregnant women, postnatal care as well, and we also immunize children below 5 years of age. So in the antenatal section, we screen women for complications during pregnancy or diseases in pregnancy. They are also examined for the gestational age of the fetus. They are also given supplementation in terms of iron, folate supplementation. They are also given anti-malarial prophylaxis, that is SP, 2 doses during the pregnancy. Then they are also immunized. Then after they deliver, they are checked during the postnatal period, and they also bring their children for immunization. On average here, on an average day, about 200 cases are seen in both under immunization section for children below 5 years and also antenatal care women. So in general, the hospital comprises of those sections. We also have laundry, which takes care of the cleaning services, and we also have a catering unit where we provide catering services to patients who have been admitted in the hospital. And essentially that is what the main sections of the hospital comprises.